Neuralgia. Now let's talk about a few caveats about a trigeminal neuropathy. So as I mentioned, trigeminal neuropathy, you're going to get objective sensory loss over the trigeminal nerve division or distribution. In addition to the sensory symptoms, remember that trigeminal nerve is not only a sensory nerve, it is a motor nerve as well. So you're going to have weakness, and the major weakness is going to be jaw weakness because the trigeminal nerve supplies the muscles of the mastication. So you're going to have a jaw weakness, and usually the deviation of the jaw is to the weak side. So whenever it comes to the cranial nerves, the deviation is usually to the normal side. So if you look at a facial palsy, the deviation is to the normal side. When you take a palatopharyngeal palsy, the deviation is to the normal side. Exceptions to this is the fifth cranial nerve and the 12th cranial nerve. So in the fifth cranial nerve, the deviation is to the weak side. And in the 12th cranial nerve or hypoglossal nerve palsy also, the deviation is to the weak side. Okay, so remember these points, very important clinical caveats. And another apparently very uh, mild lesion, that is basically numbness over the chin. That is a numb chin syndrome or a mental neuropathy. Can be very mild for the patient, but usually it has a very bad prognosis because usually a mental neuropathy or numb chin syndrome is a sign of an underlying systemic malignancy where there is metastasis to all the cranial foramen. So whenever you have a mental neuropathy or a numb chin syndrome in a patient with a known malignancy, a known breast carcinoma, a known thyroid carcinoma, or known solid organ malignancy, it is a very ominous sign. It's usually a sign of a metastatic systemic malignancy.